each patient is an individual, unique person. I think before I even get into what brought you here today, I want to learn about that person. And for me, yes, I'm a surgeon and fixing things is a big part of what we do, but I really reinforce that surgery tries to be the last option, is that if there's other things we can do, if it's injections, if it's medicines, if it's bracing, that's a really important first step for a lot of problems. I'm a really big utilizer of physical therapy because if I just fix one little part, but the whole limb isn't working, that doesn't make sense either. And so I think taking a look at the whole person, that whole limb is really important. I was an athlete, in particular gymnastics and soccer, and at a very young age got introduced to orthopedic surgery because of my own injuries. And so it was really that early exposure where I got to learn what orthopedic surgeons do. I have fellowship training in both pediatric orthopedics as well as sports medicine. And I think a lot of people are familiar with sports medicine as it could be something slip and fall off a stair or a bigger tumble down a mountain. The pediatric orthopedic side is the more unique focus on kids that are especially growing and still have open growth plates. The thing I enjoy most about my job is when they get back to things and I get to hear the successes of, I got back on my skis, or I was able to run that distance again, or maybe I'm just able to do my life without any pain. And everybody's goals are different, but I think taking them through from beginning to end and actually getting those success stories and really sharing with them all the hard work that they've done, both the physical and mental recovery, what they can do, that's obviously why we're all in this. Outside of medicine, I'm one of those people who loves to be outside at any times, to hike, bike ride, ski, snowboard. I think the most important thing that patients should know is that you're really going to get a unique, individualized experience, is that we're going to go through exactly who you are as an individual, all the different problems, concerns, make sure they're all addressed, but then also know here's all the different treatment options that you have. And it may be that it is a very bread and butter thing, or maybe it's a very cutting edge, new surgical procedure, new injection type. And so I think that's really important for kind of patients to know is all the unique individual treatment that they're going to get while here.